Hi, this is Dr. Naidu. So today I'm going to go through the type 3 Grolleau deformity correction. And as you recall beforehand, as we discussed before in a prior video, with the type 3 Grolleau, the breast tissue is deficient in all four quadrants of the breast. So the upper outer, upper inner, and lower outer, all four are deficient. And as a result, the areola in these cases tends to be really large because all of the breast tissue that was forming during puberty couldn't move into this quadrant, so it just came all into the areola. And if you look at it from the side, literally this is your areola and all of the breast tissue is just herniated into the areola. So you literally will have a small bud on the side of the breast. And this makes life incredibly difficult for these young women who have this deformity. They can't fit their clothing, it doesn't feel good, it doesn't look good. So in terms of correcting this, this can be one of the most challenging grades to correct. Depending on how severe it is, we have two options for correction. One is to put in a temporary tissue expander. So again, we'll go through the nipple areolar complex, and I like that because it allows us to reduce the size of the nipple areolar complex while we're at it. And then often I will put in a tissue expander. This is a temporary implant. So I'll put it into this area. We'll put it underneath the muscle. It's a temporary implant. It's almost like a balloon. And basically what we do is over the course of usually about 2 months, we'll blow it up every 1 to 2 weeks, and it helps us stretch out the breast tissue and to really give it a good shape. Then we let the expander sit for about 2 months and then come back and put in a permanent implant through the same incision. So that's one way to do it. The other way to do it is to put in a permanent implant, but what sometimes happens, and I can show you better from the side, is that when we try to put in a permanent implant for these very, very severely constricted cases, when we try to do that immediately, what sometimes happens is that the tissue tries to tighten up again in this area. So you end up with something that almost looks like that. You end up with a recurrence of herniated tissue, maybe not this extreme, but you end up with a recurrence of that area. So then sometimes you have to go back in and release this tissue again. So what I find is that for these really, really severely constricted breasts, putting in a tissue expander followed by a permanent implant greatly helps. And again, we want all that pressure. I like the tissue expander because it puts the strong, sustained pressure against the base of the breast and keeps pushing it out. So that way we can try and avoid this problem. So that's what I generally like to do for the grade 3 Grolleau tuberous breast deformity. For more information, please visit my website at www.naiduplasticsurgery.com. Thanks for watching.